All right, we are moving right along in the anatomy of the reproductive system. So we focused at first just on the anatomy of the reproductive system, then fetal development, then pregnancy and birth. Again, that is kind of inextricably linked to fetal development, but there are specific changes occurring to the person who is pregnant. But now we're going to focus on birth control. And this is also contraception. It's designed to prevent pregnancy. Some also provide protection against STIs, sexually transmitted infections, which is going to be our last unit. There are a lot of different methods, procedures, devices, behaviors. Um, and it's important, if this is something you choose, to find something that works for you. Okay. So why do you take birth control? So some may think the only reason that you take birth control is to not get pregnant. But there are other reasons to use birth control: to reduce your risk of sexually transmitted infections. It may reduce painful or heavy periods. It can reduce acne. It can help with polycystic ovary syndrome and hormonal imbalances. It can help with endometriosis. So that's something that can cause painful periods, infertility, ovarian cancer. So it can do a lot besides just prevent pregnancy. So why might someone want to take birth control? Again, a lot of different reasons. And again, that might not be only preventing pregnancy. So let's go through some types of birth control. So there's the pill. So the pill is a type of medicine with hormones, estrogen or progestin. There are a lot of different types with different levels. There are much lower dose hormone levels than historically. Okay. This is something that you're going to take every day. And it is going to help regulate your cycle. So some people may take this if they have an irregular cycle. What the pill does is it usually stops ovulation and thickens the mucus on the cervix, which prevents the sperm from being able to make it through that mucus. So again, you're going to use it on a schedule, take it daily. It can reduce cramps, the severity and length of menstruation. So it really helps to regulate the menstrual cycle and shorten the cycle. And it's roughly around 91% effective, but that's taking into account all the different types of the pill that there are. And again, it's going to depend whether or not you are, in fact, taking it every day or are you skipping days and kind of backtracking. It's important, though, to make sure your doctor knows you are taking the pill because some other medications can reduce the effectiveness of the pill. So it's important for your doctor to know. All right, a vasectomy is cutting the vas deferens. Okay, so it's a sterilization of people with testes. It is a simple outpatient surgical procedure. It can be reversed should the person change their mind. The more time that's passed, maybe it becomes less likely. What happens is the tubes of the vas deferens and the scrotum are cut, leaving a gap between the ends and keeping sperm out of semen. So semen is still produced, there's still ejaculation, just not sperm filled. Okay, now it is important to go for follow-up. So when a person has a vasectomy, there will be at least one follow-up appointment where they're going to have to ejaculate into a cup. And the reason is that sometimes the vasectomy is not complete, which means there are still viable sperm present in semen. And the only way that that can be known is if the person goes for the follow-up appointment. So if you have a vasectomy, please go for the follow-up appointment so you know. So this is roughly 99% effective. Nothing literally is going to be 100% ever. There's always some chance. Similar to a vasectomy, a tubal ligation, also called getting your tubes tied. It's going to permanently close, cut, or remove a piece of the fallopian tubes. Um, they can be tied, they can be banded, they can be cauterized. Now I think there's something they can actually go in internally, not even a surgical procedure, and place this like kind of like spring. It's just going to cause scar tissue, kind of a non-surgical um, tubal ligation. So it can potentially be reversed if it's been a banded procedure. Again, there's the more time, the harder it is. In this case, the sperm can't reach the egg. Still get periods, still have ovulation, just like a person who has a vasectomy still produces sperm. There's still ovulation and still have periods. And it is, again, about 99% effective. So the two types that require surgery, vasectomy, tubal ligation, although it is not a major surgery anymore, for even the tubal ligation, it can be done laparoscopically, which means those tiny little incisions. So an IUD. So there's hormonal, and a common one is the Mirena, and there's the non-hormonal, which is the copper, often called the Paragard. That's often the brand of it. So it changes the way sperm cells move, kind of like disorients them, and it also changes the mucus of the cervix. It can help with, it can stop ovulation because of the hormones if you're using the Mirena. It can last years, okay? And there's like a string that hangs down through the cervix, and that's how the IUD will be removed. So this is showing the insertion process. Now is going through the cervix. Okay, remember the cervix is closed. So this is not a time when the cervix would normally be open and dilating. So the insertion of an IUD is painful. But this is something that happens once and lasts for years. And again, similar effectiveness rate to tubal ligation and vasectomy. For the copper IUD, some people I know who have had the copper IUD have more intense bleeding than before. So that's something to think about and talk about with your doctor if this is a birth control that you choose. Also, with an IUD, your periods may stop, at least with the hormonal version, or you may have very far apart spaced, very light, more like spotting. That's also possible with an IUD. So implant, also 99% effective, can last for up to 5 years. It's a thin rod that's inserted, releases hormones that can prevent pregnancy. It's put in your arm. All right, so condoms. We have an internal condom. So this is going to be inserted into the vagina and creates a barrier that stops sperm from reaching the egg. It can reduce the risk of STIs. The ones we talked about previously really don't have anything to do with STIs or sexually transmitted infections. The rate of this, roughly about 79% effective. And then we have external condoms. They're slightly more effective. It's a tighter fit. It is worn on the penis during sex and it collects semen. It can be latex, plastic, lambskin. Also reduces the risk of STIs. So just some things about condoms. This related to both. Use every time you have sex. Put it on before you have sex. Read the package. Check the expiration date. Make sure there are no tears or defects. So look at it. Store them in a cool, dry place, like not your wallet or your jeans pocket. Use latex or polyurethane condoms, and use water-based or silicone-based lubricant. Okay, so those are all good do's. Don't store your condoms in wallets. Heat, friction can damage them. So not in the back of your jeans pocket, anything like that. Don't use nonoxynol 9, a spermicide, as this can cause irritation. So something to consider. Don't use oil-based products like baby oil, lotion, Vaseline, petroleum jelly, cooking oil. They will cause the condom to break down. So you got to use water-based or silicone-based. So if you're using a condom, you have to use the right kind of lubrication or you literally take away the protection. Don't use more than one condom at a time and never reuse a condom. All right, so how do you use a condom? So there's just a real quick lesson. Open, remove the condom from the wrapper. So you're going to place the condom on the head of an erect, hard penis. This is not going to work if the penis is flaccid or soft. If uncircumcised, pull the foreskin back first. It'll help with the fit of the condom. So you're going to pinch out the air at the tip of the condom and then unroll the condom all the way down the penis. After sex, but before pulling out of the vagina, or if you're using this for anal sex, before removing from the anus. Hold the condom at the base and then pull out. And that's going to ensure that all of the semen is kept inside the condom and then does not leak out. And then carefully remove the condom, throw it in the trash. Okay, so you're going to follow the same procedure whether you are using this condom for protection with oral sex, with vaginal sex, with anal sex. Follow the same procedure. It is good protection for any type of sex that had where penis is involved. Okay. Diaphragm. Diaphragm is this little bendable cup that works like a barrier. It's going to sit at the top of the cervix. It's about 88% effective. It should be used with spermicide, and that's something that kind of prevents or stops sperm from moving as well because of its lower effectiveness. All right, so the injection, the depot shot, it's about 94% effective. You get it roughly every 3 months. It contains a hormone, progestin, which prevents ovulation. This can also stop your periods. There is a risk associated with this, which is osteoporosis. It can cause calcium to kind of leach from your bones. So they do not recommend that you get the depot shot for longer than a 3-year period so that your body can kind of reset. Things that you can do to kind of prevent that calcium from leaching from your bones, do weight-bearing activities like lifting weights or even just simple things like walking can kind of prevent that from happening. The hormonal ring. So this is a ring that's, again, inserted and it's going to sit at the top close to your cervix, against your cervix. It's about 91% effective. And again, it's going to stop ovulation by secreting hormones. Abstinence means not having sex. It's 100% effective, the only one. And it can mean different things for different people. In this case, sperm and egg cannot meet. The withdrawal method, that means pulling out before ejaculation, is about 78% effective. The goal is keeping semen away from the vagina. It has to be done right every single time, always. And it's good to use with another backup type of birth control. All right, then there is emergency contraceptive. And this is Plan B. So you may have had unprotected sex and changed your mind about making that decision. You may have had a failed method of birth control. So condom broke. Okay. And if taken within 24 hours, a lot of the times is about 95% effective in preventing implantation. So just starting your period. Okay. So there are different types of emergency contraceptive. You can see if you weigh more, it may be less effective because remember it's one dose. It's not a different dose based on weight. And there is a possibility of using an IUD, which again is going to stop that from implantation. So here's just a general overview of some emergency contraceptive options that you have. So what are some non-hormonal types of birth control? So the non-hormonal or copper IUD, abstinence, pulling out, condoms, diaphragm, vasectomy, tubal ligation, lots of options for non-hormonal types. And there you have it, birth control. So hopefully you learned a thing or two. Planned Parenthood has an excellent birth control quiz for you. So let me just show you really quickly. So, so Planned Parenthood birth control. Okay, so if you just search just like that, all right, so you can find it. Here are all the birth control options that they're going to talk about. And then right here, which birth control method is right for me? So you're going to, if you choose, take the quiz. Okay. And then they're going to ask you some questions. All right. And then I kind of get to, so I'll just put a random age, okay? And then a random zip code, but close to where I am. Okay. And so now it's literally asking you pick 3 to 5 things that are most important to you in birth control. Okay, so are you picking it because you want to prevent pregnancy? Are you picking it because you want to prevent STDs or STIs? And if I want to, is it sexual pleasure that you worried about? Is it cost? Is it health benefits? Is it side effects? Okay, so you're going to pick 3 to 5 of these things. And I'll say if I pick these 3, just as an example, um, and how it's going to ask how important is it? This is extremely important. This is very important, and this I'm going to say is extremely important. And then it's going to, do you have health insurance? Yes, I do. But you answer honestly for yourself, okay? Yes, I will use something that has hormones because you're going to have to decide whether or not that's something that you want to do. Sure, I will. I can use something that has to be inserted. Um, Again, you can answer I'm not sure, and then it's asking me about these options and asking me which ones I have heard of. Okay. And I have heard of all of those. Okay. Literally just did a little lesson on it. And it's asking me, how would you feel? Um, Again, trying to find a good match for you because sometimes you may not have enough information when going into a doctor's appointment, wanting to talk about birth control, or if you're just trying to control your periods. Okay, so this can help you come in to a doctor's appointment informed and know what you're talking about. So, again, going from Planned Parenthood, a great resource. And that's it, birth control. So hopefully you learned a thing or two.